For instance, this afternoon I mentioned the Rostock's situation. Rostock's symptomatology is very equal, very similar to the tuberculinum symptomatology. Rostock's is not able to cure the rheumatic tendency from which is inherited by the the ancestry, so through the ancestry. So we need a remedy from another quality to cure this inherited pathological tendency, and therefore we need a nosode. The immune system of our ancestors failed in curing itself from this pathological tendency. In the next generation, we use the similar disease substance, the nosode, for instance, tuberculosis, in the remedy tuberculinum, to cure the pathological tendency which arises from the ancestry. This cannot be done by Calcarea carbonica, this cannot be done by Calcarea phosphorica, this cannot be done by Rostock's, not by Bryonia, not by Calmia, not by Pulsatilla. We need a nosode. When we look in our experience and we go through our patients, we see that with some rheuma patients, we come to the conclusion, the patient needed tuberculinum. But tuberculinum only fits the inherited pathological tendency, and therefore it's very important to neutralize the cause. The result, the acute flare-up of inflammation of joints, can be cured by Rostock's. Rostock's in the acute, tuberculinum in the cause of the former generations, the ancestry, and we can support our constitutional ability by a curative mineral remedy on the constitutional symptoms. So this is very clear when we read Hahnemann's organon and when we read the chronic diseases. It's not, Hahnemann calls, the book is named Chronic Diseases. Hahnemann treated diseases. At any time down the line, during the development of homeopathy, this goal shifted. We treat the patient, not the disease. Margaret Tyler said, the patient, not the cure. James Tyler Kent, the patient, not the pathology, not the disease. Hahnemann's only talking about disease. He makes a distinction between different disease forms, and every disease form has its own group of remedies which is necessary to cure the pathological tendency. We made a program because of this other approach. It's a quite different approach. There's much more to say about that with the intercurrent remedies, with reaction regulating remedies, with exceptions to this all. Most of these exceptions, most of these points are in the program which is recently released in the radar repertory.
Okay, and so you mean, you refer to the fact that when you take symptoms of a patient, yes, you don't throw them all onto one big pile, but you divide them over, yes, these...
Yes, yes. When you it's like a fruit basket. Mm-hmm. There are bananas, there are oranges, there are plums, there are pears, etc. When normally spoken in homeopathy, we see the main color is yellow. Mm-hmm. So this fruit basket is banana. That's not the case in homeopathy. That's not the case in the patient. The symptoms have a different origin, and we have different cause. We have to treat the different causes. So the symptomatology of the patient have to be classified. Mm-hmm. The symptoms have to be put in order, so to say. If my grandfather has suffered from migraine, and my mother has suffered from migraine, or my father and I'm suffering from migraine, it's very clear that there is an inherited pathological tendency to be cured. So the migraine is a constitutional symptom. It's also an acute miasmatic. So in the acute, we could, for instance, need nux vomica or belladonna or glonoinum or etc. But in the ancestry, we might need tuberculinum or carcinosinum or pulsatilla or psorinum based on the pathological disease structure of the ancestry. So we have to classify that. And it's, once we have been once we have got used to this line of thinking, it's very clear. Mm-hmm. It's very clear that it's logical.
Mm-hmm. So when you take the case and you have all the symptoms, you need to classify each symptom belonging to a certain group.
Yes.
And I think for this, maybe I can show you this. Yes. So we have here several clipboards, but you are using, I think, 8 groups, huh?
Yes.
8 groups.
There's the main disease forms mentioned by Hahnemann. Is, when we count them, there are about 8 different disease forms. Yes.
And then, so after you gathered all the symptoms, you classify them over the different clipboards.
Yes.
And what is then your next step?
Each classification group, each clipboard contains a group of symptoms. Mm-hmm. For instance, the acute miasmatic are in one clipboard. The acute symptoms of the constitutional symptoms are in one clipboard. The biographical symptoms are in one clipboard. So the symptoms concerning the biography are, for instance, conflict, quarrels at home, trouble at work, grief, etc. All these symptoms, which are
they go in another clipboard.
They go in another clipboard. Yes, and there then we choose the characteristic symptoms of these biographical circumstances, the life circumstances. So the remedy that fits these life circumstances, we are going to look for in the plant and animal kingdom. Mm-hmm. In the constitutional symptoms, there's no external cause for these symptoms. They are chronic, they are in our constitution, they are coming from within. Mm-hmm. These symptoms I all put in the clipboard constitutional symptoms. Mm-hmm. These are the symptoms we have no explanation for. Okay. If we have no explanation, then they must be constitutional. They must come from within, and they have a miasmatic, constitutional miasmatic cause. And in that case, we put them in one clipboard, and then we are going to look for what characterizes these symptoms, the characteristic symptoms, the sort of strange, rare, peculiar symptoms, where we have to choose a mineral remedy on. And then we go to the clipboard with the inherited tendency. Grandmother died of cancer, father had tuberculosis, mother has suffered from thyroid gland problems and eventually became a diabetic, and nephew died during an accident, etc. So we see in the family history, we see certain disease forms, and we are looking for the pattern. So if there is, for instance, a syphilitic, a destructive tendency in the family, with sexual abuse, with alcoholism, with suicides, with criminal behavior, etc. If that occurs in the family, then we know that if this patient suffers from an acute disease, that he's at risk. This might create a destructive acute disease in this patient. So we are looking for the inherited pathological tendency, and if there is a syphilitic tendency, we have to prescribe syphilinum to neutralize this syphilitic tendency coming from the ancestry. Mm-hmm. This is, and the syphilitic tendency is forwarded to the next generation and shows itself in sudden, acute flare-ups with a very destructive tendency. Mm-hmm. So it's a very clear and once we get used to it, very easy and accessible methodology.